share the presentation because I couldn't find a way to share it from my desktop. The way of AI, as you know, that in Dubai Police we do have a strategic map till 2021 to provide all kind of systems and applications that can provide a service to 5 of the sectors that we're working with. First of all, systems and applications that provide better public or customer service, where the AI can predict and know what is the customers they need, what are the things that is required to provide those kind of service to them. Second of all, even for the crisis management. And as you know, nowadays we are living in a crisis which is spreading the COVID-19 across the world. So what are the things that we are using to stop spreading this kind of thing? The other part also for managing the human resources and the workload in the Dubai Police. And as you know, we are in the front line among with other sectors like the health, the safety and security. So we have also to provide all kind of tools to the people who are living in the front line to protect them and also to stop the spreading. I don't know if you can, Isa, can share the presentation. Anyhow, so probably you have heard about in the news that Dubai Police is one of the huge government in the world. We're using the latest technologies. One of the latest thing that we're using is to sense the temperatures of the people. And as you know that currently nowadays we have provide different kind of cameras across the city, which is part of the Agile project, where we are connecting all the CCTV cameras in the city. So the first time we were using those cameras to detect the wanted using facial recognition and behavior analysis. Now, because of the spread, we have injected with it to analyze the heat or the temperature of the people who are moving across the city. So this is like an additional feature that we are currently working. Another thing that we are we are testing it right now in the malls and on the street is to analyze the distance between the people. So those cameras can analyze how many meters that each person should be available or should be away from his partner or the people. When they're coming to so close, give us a warning. So, and in our daily briefing internally with Dubai Police, we're using this kind of reports to show our decision makers what are the things that we should do. And thanks God, in UAE and even in Dubai, everybody is aware about the situation, and also with our partners, what are the best way to provide all kind of information to the people. So yeah, we also, the most probably still we're working with and is to predict the COVID virus when it's gonna be ended. And as you've seen maybe in the news, everyone has a different algorithm, everyone has a way of calculating those kind of things, which is still not clear. So some of the people are saying, or studies have mentioned that it's gonna be end probably by August or July, and maybe we're gonna have a second wave. So let us provide an AI to help us to provide all kinds of necessary information. And as you know, probably if you guys correct me in the panel, the correct information, once you're feeding the correct information to an AI, it will give you the right answer. If you give them a wrong answer, it will give you also a wrong decision, a wrong answer. So This is like in general, what are the things that we're working here in the workplace and in the government in general. I think, Doctor, if you enable your mic is in mute.
Oh, sorry. So I think the Ayun project is already contributing to combat the COVID-19 pandemic, where we have this mega project, as you've mentioned, monitoring social distancing, enforcing face mask, or reading the temperatures of people around. It's let's say it's the right investments made earlier, and we used it in this pandemic. And this is key, a key message I can get, where you can start early in investing in such technologies, and then you find utilizations or your investments paid throughout the years. Thank you, Brigadier Khalid. This brings us to the other end of the spectrum. I mean here the private sector. I'd like to move now to Bashar Keilani. What challenges have the private sector seen during this pandemic, and how have the emerging technologies helped in resolving some of these challenges?
Thank you very much. Actually, we're all in this pandemic together, private sector, public sector, and we are all finding our way moving forward. However, I think what has happened in the last few weeks is that we have all started to work towards a new normal, which is very different from the normal that we had a few weeks ago or a few months ago. I think we have all adapted new ways of working. So we have in IBM moved 95% of our workforce to work remotely. And that has been a very challenging aspect, because we needed to make sure that we and our partners and clients all are enjoying business continuity and resiliency. We started to work with them on adapting and changing the business processes so that they can work in this new world that is changing the world as we know it today. We believe also that moving forward, this new normal will be different from what we have known in the past. So I think we will probably redesign our working offices. Travel restrictions will remain for a longer time, and we will have to be more agile in the way we interact, and we have to accelerate our digital transformation. And for that, we really need to make sure that we have the digital infrastructure that can do that quickly, but also that we have the knowledge and the know-how and the skills in the people that are in the workplace. So this is why I'm talking about the digital skill gap that needs to be closed much faster now to help with this accelerated digital transformation. IBM has an Institute for Business Value which did a study last October only, where it said that 120 million jobs around the world have a digital gap that they need to close within the next 3 years. This is a huge number, and these are jobs that will ingest AI and new technologies as part of their workday, so that they become more efficient and more effective in the way they deal with their daily tasks. And as we know, every job in this world will change, and COVID-19 will accelerate the digital transformation. Some of the tasks that are repeatable tasks and simple tasks can be easily done through AI, but tasks that are requiring knowledge, that are requiring critical thinking, that are requiring interpersonal strings will actually evolve and develop, and there will be new tools that will help using AI to make these jobs more efficient and effective. It will make the work of the police force more effective, doctors will be more effective, healthcare providers will be more effective, engineers, retailers, every industry will be impacted by this change in digital transformation, and these jobs will become more effective and more efficient. In the next 10 years, probably most of the jobs that we know today will be altered or different, and 60% of the jobs will probably that will be there, we don't know about them today. But I can tell you one thing about them. They will mainly be around data and computer science. They will be around AI. They will be data sciences and so on. So these are the kind of skills that we need to build and accelerate quickly in this time, so that we can evolve to the new normal in a world that has the right skills in order to build new business models, new roles, and help provide a digital infrastructure that enables people to compete. We will also have to consume these new skills in a different way. We used to go to universities and have long courses, masters and bachelor. At that time, the half-life for skills used to be 10 to 15 years. Today, the half-life for a skill is maybe 3 years, and then you have to adapt and move on and develop something new to go with it. And this is why we are providing digital platforms today where people can learn certain skills and get digital badges that kind of certify that they've reached certain levels of knowledge, and that can help them with finding new roles or improving their roles in the incremental world of digital transformation that we will live in after and beyond the COVID-19 environment. And every business process you think of, whether it is financial services, retail, operations, technical operations, these are all business processes that will be changed. AI will be part of each and every one of them. AI will be ingested in these business processes. Wherever you can make a prediction better, quicker, faster with AI, you will be able to do it. You will have chatbots everywhere because they will handle the distribution of information. You will have AI reading sentiments, feedbacks, sorting out documents, aggregating data points. And these are not complicated tasks that require deep knowledge of engineering. These are skills that can be acquired quickly through the digital enablement platforms that we are talking about. And as part of our reaction here in this part of the world to this accelerated requirement for digital skills, especially AI and data science and so on, we've made available the Digital Nation platform to organizations between now and August for free, so that they can start with their digital engagement and help their people with their career paths as they move forward. I think this is an important aspect. Beside the technology infrastructure, the human element of digital transformation is quite key.
I'd like to re-emphasize this point as well, the importance of reskilling, let's say, our human resources as we develop technologies. They both should go hand in hand and together to
Absolutely.
achieve their optimal results, let's say. Let me move now to the audience and ask them for their opinion. In your opinion, which sector in the UAE has the best response to challenges imposed by COVID-19? I think it should show you on your screen right now. Is it government, transportation sector, retail sector, banking, and hospitality? Which one of these? We'll get back to the results later in the session. I'd like to go now to Dr. Peter. One sector that has been put under immense pressure during the pandemic is for sure the health sector. Dr. Peter, can you please shed some light on the role of emerging technologies in this sector during the pandemic? And there is another question. Do you think that the current healthcare system is in a position to accept innovation?
Well, thank you for the questions. I'll start with your second question first. I think definitely that the health sector is very open to innovation. It has always been open to innovation, new technologies, and developments in science due to the connection between practice and the studies of medicine and innovations for medical countermeasures, vaccines, technical devices and everything. So I think I would call it perhaps one of the most evolving and also open areas and sectors for just that. Now, in regards to the use of AI, for example, in managing their coronavirus pandemic. Now, this is happening all over the world. I mean, AI now is an integral part of our lives, and the health sector is, of course, no exception in this. An interesting fact is that the first cases that gave an indication of an unusual disease pattern was detected by an AI system in the Boston's Children's Hospital. It's a health map, a project which sources or mines data from from social media sources and regular media, which is health related. They sent out the first alert on January 30th that there was a unknown pneumonia being spread in Wuhan, with 7 people being hospitalized. And of course, as was mentioned before, we live in an age of information and big data. It's not going to get any smaller. It's just going to expand. And human capacity for interpreting this data is just not enough. So machine learning system is where we have to turn to better interpret this data, which is very overwhelming. Now, of course, we have to look at AI as not a solution to everything. Again, it's only a tool that we can use to complement existing and established methodologies, such as public health surveillance systems and traditional epidemiology, for example, when it comes to contact tracing and case follow-ups in the wake of the COVID diseases spreading in the UAE, for example. There are many global projects using AI to help combat COVID. I'll mention a couple of examples which might be relevant. One is predictive analytics. Now, this look at large sets of data to try to predict which patients might actually develop severe disease more than others. And this has been used in a number of countries, I believe. And one marker, for example, they saw a connection with elevated levels of alanine aminotransferase, ALT in short, which is a liver enzyme. Another example is artificial intelligence diagnostics that can predict if someone is likely to have COVID-19 based on their symptoms. One such study looked at a very broad set of different symptoms, not only the traditional fever, dry coughs, but also identified the loss of taste and smell, anosmia as being a possible indicator, perhaps even more indicative of coronavirus or COVID-19 than fever. Also, as was mentioned for the case of Dubai, now you can monitor many things using the established surveillance systems such as traffic cameras, closed circuit TV, and so on. I'm sure, being in use is trying to predict or trying to monitor the occupancy of stores or restaurants, using information coming from closed circuit TV camera system feeds and so on, facial recognition and other things. Also, the potential exposure to a virus can also be monitored through AI. And we have a couple of examples. In Bahrain, they have the app Be Aware, which is used to inform if someone has been close to a person confirmed to be infected. And here in the UAE, we have Al Hosnap, very similar, which uses Bluetooth technology encrypted to notify if someone has been in close proximity to someone confirmed to have been infected, and lets the health authorities to provide assistance if needed. So there are many examples of where this is actually being implemented today already, but I think in the future, we're going to see a lot more and more of these innovations.
We'll leave the future of the healthcare system maybe to the second part of this session, where we discuss the future post-pandemic, in the post-pandemic era. I'd like now to move to another sector of an integral part of any city, which is the logistics and transportation sector. Here, I mean air, land, or sea. Dr. Hamad, what are your observations during the pandemic for this sector? are emerging technologies playing a role here or not?
Yeah, thank you, Dr. Isa. As far as the challenges imposed by COVID-19 is concerned, we could think of two streams of which AI have been utilized or could have been utilized from a mobility and transportation point of view. I think Brigadier Khalid has touched on the applications of AI that has been utilized by Dubai Police. I will discuss in another perspective from mobility point of view. So I could think of two streams really. A stream pertaining the on the ground live applications of AI. And the second stream, which pertains predictive modeling for planning COVID-19 responses. So if we begin with the first stream, I'm referring to AI-supported technologies that we have been developing in the past. And now we pick their fruits during this pandemic. So a typical example is these applications that we use now, like Zoom, MS, Teams, and all these things. They have been there, but only now we've been picking their fruits and utilizing them to the most. In the context of mobility, we have wonderful applications like Talabat and Carriage, which have a significant role during this pandemic. And yet, what makes them even more interesting is the AI engine behind them. So allow me to elaborate more on these applications because they would provide a more concrete example about what AI could offer to humanity. And they could be inspiring examples for other applications that we could develop in future. So for Talabat, for example, the problem of dispatching the closest driver to a restaurant at the right time when the food is ready is a very complex optimization problem. So if the driver is dispatched too early, then the driver has to wait, and which means we have a resource wasted. And on the other hand, if the driver is dispatched too late, then the food may not be fresh, and it may arrive late to the eater. So one of the importance optimization problems of these apps is to improve dispatch time accuracy. And how is that done? Through AI. So we need to know, is the driver spending so much time in or around the restaurant because, for example, he didn't find parking, or he is, for example, because the pickup process of the restaurant is so complicated, so he couldn't pick up the food very quickly. All these are being traced by these apps, and this was announced by Uber Eats, for example. And the way they did it is not through conventional GPS, because GPS has its noise. So what they did, they have utilized, for example, the accelerometers and gyroscope sensor data from the driver's mobile phones. And these has helped them to develop activity recognition algorithms to understand whether the driver is now walking from his bicycle to the restaurant, or he's standing still, or he's driving. All these could be detected by AI algorithms. So as such, we could understand how to improve the accuracy of dispatching the drivers to the restaurants at the right time. So think of this as a successful example. And on the other hand, we have another example from the grocery sector, for example. I think all of you has experienced in the last days delays in delivering your grocery items, because the grocery sector was not ready, was not ready for that drastic demand that has emerged suddenly. And that's a typical and a clear example of the difference between an AI-supported application and a non-AI supported application. So that's one example which I could think of from the mobility point of view. For on the ground live applications. But we have also other applications which pertains the planning. The planning and decision support systems using AI algorithms. So there is high potential behind mobility analysis and using mobility data to develop predictive models, either through AI algorithms or through conventional mathematical models. We need to understand first the disease spread transmission. And as you know, disease spread is all about people's mobility. So big data processing and modeling of people's mobility patterns would identify exactly where are the geographical hotspots that contribute to the most to the pandemic. And as such, decision makers could make optimum decisions to lock these specific areas, for example, either fully or partially, and find the right balance between economical relief and city lockdown. This becomes even more powerful if we bind this data with data from wearables or mobile apps that traces quarantine and infected people. So let me give you an example. We started, for example, modeling the epidemiology of COVID-19 in Abu Dhabi with our colleagues in the Department of Health. And so the model now that we've developed forecasts the number of patients, number of beds, number of ICU units required during this pandemic. But I do realize that with the mobility analysis and big data analysis, we could achieve much more than that. We could know exactly where are the areas that needs to be locked down. So, for example, telecommunication data. I think one of my colleagues, Dr. Khalid, has mentioned big data as part of the new trends and new career trends, which will shape the future of workspace. So telecommunication data, we have big data from telecommunication companies that tells us exactly where people go and who do they meet. So imagining utilizing this data to develop machine learning algorithms, which could alert us on real time about risks and forecast the future of disease spread under different scenarios. So these are the things that come in mind regarding the transportation sector. And I'll pass the mic to my colleagues.
Thank you, Dr. Hamid. I think we could understand a lot from Talabat on the way they manage their resources to move it into managing the government resources in the same way, expecting demand and dispatching our resources to deliver services to our citizens. I would like to stay within the transportation industry, and I'd like to talk now to Mr. Adil. How can we ensure and improve the safety of people who use public transportations? Or can the current technology help us in this regard? Or we're too late? I'm not sure.
Thank you, Dr. Isa. Just I think, let me start with a tweet from His Highness about the artificial intelligence. He's saying, artificial intelligence is the next major revolution of times. Our goal to be one of the most advanced countries in this regard. So even transportation and safety, it's part of the society. If I need to focus in safety. There are actually three main reasons behind any accidents. It's either human distraction, or it's traffic, it's maintenance, or it's road engineering. For speed, maybe he cannot focus. He's using his phone, or many different reasons. One of the great examples which we implemented in Road and Transportation Authority in Dubai, we use artificial intelligence to read the algorithm, to read the face recognition of the bus driver. So in case if he is tired, or in case if he is playing with his mobile for any reason, or is not focusing So immediately the system will take an action. First of all, it will alarm, and at the same time it will send alarm to our operations center, which are working 24/7, so they can call him and see if he's okay. So by implementing this concept, we've been able to reduce the human distraction by 83%. And during last year. So it did a major improvement, and we reduced the accident in our bus network to become one of the best rate worldwide. And this is, I think, one of the great examples which we can use artificial intelligence to enhance the safety in the city. And for sure, there's a lot of other use case also. You can use a big data. Today in RTA, we have a lot of data. We have huge data. We have data coming from from ticketing system, which you can use it in the metro and the bus and marine. You have data from the TPs, which are getting you from the taxis. We have the automated passenger count, many different data, and how we use this data to utilize them and to transfer it to very useful data. And I just mentioned by Dr. Hamad, even for the planning, I think one of the during last month, especially last let's say 2 months, we had a lot of change. Usually in public transportation, you don't have to change maybe 3 times or 4 times a year, but during the COVID-19 and during the challenge we had to change. We have to implement a new model like the social distance in each bus. If the bus it was carrying 50 passengers previously, now it is carrying around 20 passengers. So how utilizing those data to improve planning, to add to enhance the network to satisfy the current need. And I think if even we spoke about, as you mentioned, Dr. Habai, Talabat, if we take an example today, all the private sector and the mobility like Uber and Kareem, I think the main difference they had is utilizing the AI and how those companies were able to reduce the average pickup time worldwide from 18 minutes or 15 minutes to become now around 4 minutes or 3.5 minutes, and this is enhancing the customer experience by depending on those technology. And I think if we talk about the future also, one of the things, as you all aware, by 2030, 25% of the movement in Dubai, it will be through self-driving, and self-driving is all dependent on AI. So we are doing nowadays a lot of tests. We had last year a Dubai World Challenge for the self-driving, and we had more than 5 leaders company to come in Dubai and to do. We did more than 21 different tests during the humidity, during the rain, during the weather, the hot weather, and we are working in this to enhance the to bring the self-driving. It's one of the main challenges. We don't have enough experts nowadays in this field, and I think one of the main reasons we did this competition to bring all minds from different parts of the world in Dubai to make it happen. And the last point for the COVID-19, I think we have a lot of things. One of the things now, one of the new rule, we don't have for any taxi only 2 passengers. But to make sure we have only 2 passengers in each taxi, we are using our camera and taxi and the AI system which is available to notify just in case if anything wrong happened by using those cameras. And thank you.
Thank you, Mr. Adil. I think it explains a lot the way you use AI in different aspects to provide better service to our citizens, as well as ensure that this service is safe and secure. I'd like now to move to Dr. Abdurrahman and ask a fundamental question. Through the session so far, we've been trying to find a technical solution to all problems we are currently facing because of the COVID-19 pandemic. are these emerging technologies, AI included, the magic solution to all the problems?
That's a very good question, actually. Unfortunately, I believe that there is no silver bullet. It would be nice if you can just apply a single technology and make all your problems go away. But it doesn't work that way. For these technologies, they are designed to do specific things, be it blockchain, be it AI, be it 3D printing, and so on. What we can do is try to actually improve the chances of these technologies helping us solve our problem. So that comes to a set of factors. One of them is the governance. So if we look at countries that have been very successful in applying these advanced technologies, AI, for example, you'll find that they took action very quickly. And they set it up not just as deploying a certain technology, but they set it up in the right governance framework. For example, flying drones to monitor the temperature of people. Now, I'll give you two examples. Let's say that the governance framework supports you. It sees the need for this and immediately supports you in actually getting that drone up and running, monitoring crowds, and so on. That's a very successful case, right? You can deploy the technology and get results out of it. If the governance framework does not allow you to fly that drone in the first place, there is nothing that you can do about it. If it restricts you from doing any type of monitoring, for example, that puts a very tough challenge in front of you to actually deploy this technology successfully. The second one is the correct implementation of these technologies. Now, this AI, for example, let's say you want to deploy AI in diagnostics in the medical domain. Now, the fact that there is a lot of technical points that you need to consider to deploy these technologies correctly. And it's very important to consider every one of these points. So if the system, for example, diagnosed somebody as a COVID positive, what does that mean actually? What did the system do? You have to be able to actually understand the system, be able to audit the system. Why did it take such a decision, and so on? So to answer your question is, you cannot just deploy this technology and expect it to solve your solutions. It comes with a set of considerations that you have to take into account to maximize at least the chance of it helping you in addressing these challenges. Thank you.
Okay, thank you, Dr. Abdurrahman. Let's now move to the poll question, and I'd like to ask can you hear me? I'd like to ask the attendees another question. Which mode of work would you prefer post-COVID-19? Is it working from home, working from a co-working space, back to the office, or hybrid of the above? And you can also use the same the Q&A button to send your questions to the panelists here with me and ask questions through the Q&A button. And I'd like now, speaking about the post-pandemic era, I'd like to go back to Brigadier Khalid. And let's discuss here what will happen once the pandemic is over. What should governments of the future do to be able to cope with the future crisis?
Thank you, Doctor, for your question. As you know that nowadays even the government have been started putting the right plans and also to be ready when the number of cases have been reduced. And as you know that there's a lot of opportunities among not just the government, even the private sector. And probably we have seen a lot of people nowadays, they are very keen to use the latest technologies, especially on the mobile application and voice over IP. And as you know, nowadays, everybody is using different chat or online meeting, which is very highly demanded nowadays. Even as a government, also, we have to think about the data protection. because it's all the things that we're working, and especially the people and the government, private sector, they depend on the data that we are shared among others. So we have to protect this data from the ethical hacking, from the burglars, from different of crimes nowadays, which is hitting very hard on the our network. We have also to increase the online media consumption. That is also, we have to think to increase the data capacity on the ISPs, on over, even on the network bandwidth. You probably have heard a lot of in the news that a lot of systems have been crashed because there was a high demand on using those kind of technologies. And also they change the culture. The culture is going to be changed. People will start using their online service. They're going to work remotely more than going ahead and work on the traditional way, which is going to the offices. Also, we need to automate the AI processes. So we need to predict what are the customers' needs, what are the things that they require before asking them. We have to ensure that the continuity of the service that we provide to them 24/7. And also, as a government, we need also to have a cloud system among the government where we can host all our systems. We're gonna share those data and provide the system closely enough in the government sector, and also to provide a strategic partnership with our partners in the private sectors to have what are the latest technologies, what are the new things that gonna provide better service to the people.
I guess it comes to three things, as you've said: the right infrastructure, the right application on top, and the right culture from people. How do you rate the UAE in these three aspects? Are we mature in those three aspects: infrastructure, application, and people culture towards the technology?
Well, Doctor, as you know, that UAE, we are in the top leaders of using technologies across the world, and we have once we have a good vision and good leaders from our government, we are so happy to provide those kind of service to the people. So yes, we are in UAE. We are having the best technologies, best strategies, and even our future map is ready with us.
I think we are lucky here being in this part of the world. I'd like now to move to Dr. Peter. As we've seen during the pandemic, that the world faced a shortcoming in the healthcare systems, which raised a lot of concerns to many people. My questions to you is, Doctor, how the healthcare system will adjust to this shortcoming after COVID-19? How an important role will emerging technologies play in helping the healthcare system?
Thank you, Doctor, for the question. I think there will be a very big difference, a very big change, a reprioritization of the health systems around the world. Infectious diseases is always something that we've been exposed to, but it's also something which, you know, with the greater consequences of something reaching a epidemic or pandemic level, as with the coronavirus. It's never really not taken seriously, but it's never been given a very high priority, and that is definitely going to change, because the world has never seen, at least not in modern times, such a big effect on everyone across the world. And of course, this human tragedy, which it is you know, still developing, and we don't really know where it will end and when. But I think there again, with every sort of transforming or societal transformation events comes also a lot of good, a lot of innovation, and a lot of opportunities. On the first part, in regards to the application of AI in the post-COVID-19 world, again, as I mentioned before, this is all about how to interpret big data, and data is always recorded from all different sources. We will have public health data from pretty much all countries in the world following this pandemic, to very carefully dissect and interpret every single aspect of the response, the interventions and the outcomes, and of course, the human toll on public health workers, the systems, and of course, on society itself, not to mention the economic impact. But I think this will provide, of course, a big opportunity to manage future decisions during crisis a lot better. So this is a very tough but valuable learning experience in many ways. And also in how to plan and how to prepare our public health care systems for the future. I think we'll see a lot of new investments in research labs, not only diagnostics. Unfortunately, one outcome of this has been that pretty much all countries have been trying to fight this with their own internal strategies and lack of a coordinated global response in many ways. And I think that a lot of countries will try to prioritize developing their own research foundations for infectious diseases in the future, which is both good and bad, especially considering that the risk and responsibilities of having these labs, especially considering certain theories going on right now around the world. Also, I think that with the information we'll get, we'll have a better understanding of the complexity of transmission of diseases. Using AI to interpret vast amounts of data from different sources, how different societal factors impact the spread of disease. Of course, we know that the airline industry is, and how badly has been affected, was really the first to be shut down, and what were the effects of this? How effective was it? In medical research, I think that we will come out of this with a much better understanding of the transmission of this virus and how it interacts with our immune systems and affects our organs, so that we will better be able to find where in the whole chain we can intervene with countermeasures, whether vaccines, antiviral agents, or other treatments. Now, I mean, speaking as a former medical researcher, again, the use of machine learning is something we've been using for decades when we've been looking at or studying the evolution of viruses and their relationship to each other using phylogenetic analysis and so on. So it's not a novel technology in this field. I think maybe one of the big and more immediate changes will be that we will be having more effective systems to monitor future health threats, and they will be a lot more sophisticated, but also more automated through the use of deep learning algorithms to try to detect these threats a lot faster, such as with a health map, which is more a machine learning and data mining system. And also perhaps these systems will help to give us projections and recommendations early on where we can most effectively intervene to avoid, as we said, complete shutdowns of society and the financial and human impacts this has. Also, we can look at developing better risk assessment methodology and risk analysis across all sectors, not just in silos for each sector at a time, but it has ripple effects throughout society. On a more general scale, I would say that this will most likely lead to a rethinking of the public health systems in the way that we will see telemedicine become a lot more common, and also remote doctor-patient interactions for non-acute acute matters. Of course, one of the effects of the COVID-19 has been a large reduction, up to 50-60% of patients seeking emergency care at hospitals. And maybe this will also be followed by a large number of home innovations for the home when it comes to monitoring health and also for, if we look at the use of AI for differential diagnosis of patients and conditions, also home testing of, oxygenation, which we know that oxygenation equipment was very popular now in the start for people to get hold of to monitor their health in regards to COVID-19. So I think this remote consultations, this has been around for some time in the airline industry to quickly connect to a doctor for assistance and so on, and also in the shipping industry, I believe. So I think we'll see a lot of these novel interventions emerge, and I think that this is a big growing industry eventually to find solutions for this.
Thank you, Dr. Peter. I think a key message here is that the healthcare system a public healthcare system is no longer the responsibility of a certain country. It's like a global issue, and this pandemic has taught us that the public health is a worldwide. You should have a worldwide system that supports you in each and every country. And telemedicine, where it was there, let's say, before the pandemic, but people were not accepting it. It's now more acceptable, and we'll see more in the future. This is a major change in such the very regulated, let's say, sector of the society. Let's move now to the transportation sector with Mr. Adel. How will this pandemic affect the transportation business post-COVID-19? What key strategies will help us mitigate the challenges around it?
One of the main things, I think, post-COVID-19, the transportation will go, especially for the company, especially the people who are working now online and working from home. So the demand on transportation will be less as it is before the pandemic. And there's a lot of things now changing in the public transportation. The social distance concept. Previously, most of the metro cabin or most of the buses were a crowd, but now by implementing the social distance concept in each buses, the number of utilization will be almost 50% down, and even same thing will be implemented in all mode of transportation, and even a lot of things now is coming, especially if you want to write, you don't want to interfere with the drivers, and recently we introduced this screen or barrier between the driver and the customer, so the people feel more relaxed toward this one. And as I said, a lot of people, they will achieve their work, or they will do their work from home. So the demand on the transportation will be less than it was before the pandemic. And I think one of the also major, most important things is a new technology like the bus on demand. This is a new concept which Uber has been radically changed the taxi industry. Now a new concept is coming. It's called bus on demand. Even for the people who is using public transportation, even they will not use it as it was before. And I think those are the most important things will be changed in the transportation sector.
I think it's interesting to see how you brought another business model where you have a bus on demand instead of the regular routes you do in normal circumstances. And it's a good example of government agency reinventing itself to correspond to different needs. Thank you, Mr. Adel. I'd like now to move to Dr. Hamad in the same transportation domain. Let's look at this sector as a whole, land, sea, and air. Where do you see the future, and how do you see the future of this sector in all of its forms?
Well, to put it short, I see that the whole sector will drastically change, and we have to start planning for that change from now. I'd like to elaborate on the point Dr. Adel mentioned. I see the changes are driven by 4 new realities. The first reality, which Dr. Adel mentioned, is the change in the work and study modes. A lot of people will be working from home, and that naturally will reduce the demand on transportation networks. The second thing is about the culture and policies. So even after COVID-19, you will still have people having that culture of keeping distance between one another, which will mean that we will have to have either, for example, buffers between people sitting in a bus, and that means we have to increase the supply. So we have things decreasing the supply, we have things increasing the supply. So this is one thing. Also, there will be a huge change in the tourism sector. And I was surprised that day to read that it is forecasted by the World Travel and Tourism Council that 100 million people in the tourism and travel sector will lose their jobs. So we are looking at a whole sector which will reduce pressures on our transportation sector significantly. The fourth reality is about supply chains. So now we have speculations from experts that the world trade after COVID-19 will change. So countries will tend to be less reliant on imports, more self-dependent in their local stocks and production lines, especially at sectors touching food security. So what does that mean? It means that we could expect changes in the logistics, where more stocks are delivered through land modes as opposed to air or sea modes. And that raises the question, like, is it feasible, for example, to plan for building train networks as an alternative to current road networks? So all these things. So I stress on the point of planning. The new realities will need substantial replanning from us. Our current system is based on our current reality. So let me give you an example, like pricing the bus ticket, for example. For pricing bus tickets or any product, yeah, we tend, as mathematicians, we tend to use a mathematical model called discrete choice modeling. So what that does is that it helps you model how customers consider an alternative between one or two or more modes. For example, say the bus would cost you 5 dirhams for a trip, but 30 minutes for a duration. That's option one. Option two, I will take a car which costs me 200 dirhams, but 10 minutes in duration. So cost is higher here and duration is less in here. What would you choose? So if we model this across our population, we may say, for example, forecast that 60% of the population will tend to choose the bus. Because they are more sensitive, for example, to price over trip duration. Yeah, this reality will change. Will change because the population has changed, the people attitudes, their incomes, their culture has changed. So as such, the demand, the mathematical demand and supply model has changed. So we tend, as mathematicians, we tend to play with the supply and demand through imposing, for example, certain prices, which shifts demands from this mode to that mode based on our capacity of expanding the infrastructure sector, and based on our yearly plans. We have to reconsider all that. So we may end up, for example, with decisions which are very positive. That because of, for example, reduce in road networks, we may consider closing lanes in our very wide streets and replacing them with autonomous buses lanes. So that could be an option which would reduce carbon emissions, improve traffic safety. So we see a lot of opportunities post COVID-19, but the central message I want to say that we need to replan the whole sector, and we need to start from today.
Thank you, Dr. Hamad, for this insightful view. And now let's move to Mr. Bashar. I prepared a question for you, but I think I'll take the audience question, since you word them too much maybe about the skill gap and reskilling of our human resources. They are asking, how would AI affect the current employment, or current, or will it decrease the number of employees? That's one. And the other thing, what would the future jobs be like?
Yes, thank you. Thank you very much, Dr. Isa. I think people will remember this time as the great lockdown time, like the Great Depression. This is the great lockdown. And there was a white paper published by the Institute of Business Value in IBM about what is beyond the great lockdown. And I think it will be probably a golden age for AI and AI skills, because we will now have to reimagine and redefine our world using AI. And the challenge this time is not to have big data to make decisions, but to use little data and advanced algorithms to make the right decisions. And this paper has 5 elements, and we spoke about the first element, which is the culture and the skills, which is, I think, the key aspect of it. The nations will compete based on their level of knowledge and skill around AI. The second element is definitely that we will have to reimagine every business that is there, because we will consume services, we will consume products in a different way after the lockdown than we used before the lockdown. And that means that we will have to understand our customers better. We will use AI to make proper predictions. It will be a completely new world in terms of interaction between suppliers and customers. The second aspect is, as Dr. Hamid just mentioned, we will completely redefine our supply chains, and we will define different priorities, and we will have different capacities and different integration points, and AI will be a key determining factor on how to integrate these supply chains, where to get the best value, how to combine it all together, and that will be a big play that we will be looking at. The third element is really the discussion around having an agile digital infrastructure that is going to help us understand this data, create insight from data, handle all the new complexities of the new world, out of which there will be resiliency, working from home, different logic questions, every single aspect of our life. And we heard about transportation will be redefined. We will run buses at half capacity. We will redefine the way people shop at malls. We will completely reimagine our financial services. We will completely reimagine the way we do retail, how we go into restaurants. All this will now require a cloud-based digital infrastructure that is flexible, that has cybersecurity based into it. It will completely transform the way we have been working. And going now, imagining all these different aspects of our life and where AI is going to play a major role, I think there will be more jobs to come out. There is a study that says by 2030, there will be 85 million jobs that require AI skills. And I mentioned at the beginning of my discussion that in the next 3 years, we will have to upskill 120 million jobs just to make sure that we cover the digital gap that we have in our workforce. I think we are coming up to an era where data and AI are going to be essential skills in any world. There will be new jobs. As I mentioned, 60% of the jobs 10 years from now we do not know about today, but I can tell you they are in data science, in AI, in the digital world more than any other environment. And we will use the skills to improve our healthcare system. As Dr. Peter mentioned, a lot of it is now about data and data science. We will use these skills and digital world to integrate our travel and transport network. we will have a completely digital understanding of the financial systems that we will work on. And this world beyond the deadlock or beyond the lockdown is going to accelerate the flourishing of AI and bringing value out of this digital data-based world.
Thank you, Mr. Bashar. I'll move now to Dr. Abdurrahman. I'll take also 2 questions from the audience here today. They are worried about their privacy in the AI era and worried that if we rely too much on AI, what if the algorithm was wrong?
So in terms of privacy, that is quite a pressing challenge, actually. The privacy of data comes up a lot when we talk about AI, when we talk about collecting data, putting them in the same place, let's say. Especially when you're collecting large amounts of data about everybody, which is what makes AI very effective, as we said. I mean, we live in the data age. You can look at yourself as a person who's leaving a data footprint. Now, the privacy of this can be addressed. So the research community is actually looking at how to protect people's privacy while enabling AI algorithms to actually do what they need to do. There are techniques such as differential privacy, homomorphic encryption, that companies like Google, like IBM, like Microsoft are actually looking at very closely. So this is indeed one of the pressing matters that needs to be addressed. But the challenge is still there. I would say that AI models are prone to leaking data. So one should approach it carefully for the time being, but we should avoid paranoia as well. So these algorithms, in the end, the more data you give these algorithms, the better the predictions are, the better the results that you get are, the better the services that you get are. So it is a trade-off, but it's not as bad as it sounds. So you're not giving up your privacy totally to actually get these services, but the privacy aspect is improving. For the second question was, can you kindly remind me of the second question actually?
What if it was wrong? We are relying on an algorithm which is wrong.
That is actually a very good question. So let me actually talk about the perception of AI algorithms. So how do we perceive these algorithms pre-COVID, post-COVID, and during COVID? So if you move 6 months in the back to the past and mention AI algorithms, what are the biggest challenges of AI algorithms and how do we approach them? You will find that almost in every topic, the idea of AI replacing our jobs will come up, right? So we have to approach it very carefully. These technologies will eliminate certain jobs. We have to be very careful when deploying it. Otherwise, we'll lose many jobs. Now, during COVID, everyone has actually shifted their view. Everyone is looking at AI as the tool that will help us protect people's jobs. It will put us back to the job market. It will make going back to working safer, right? So we have thermal cameras monitoring people's temperatures. As Brigadier Khalid mentioned, you have cameras that are monitoring the social distance of people. And we will see a lot of deployment of these technologies in a wider scale. They might be not, in this context, mission critical. So we have to approach, we don't have to approach it with the criticality of, let's say, applying it in the medical domain. But one example that I would like to mention was a technology that we were working on in the AI office. So we decided to take a different approach to smart cameras. So in addition to the thermal aspect of that, we added an intelligent algorithm that is able to estimate people's ages. So it can tell you that this guy looks 70 plus or is, for example, 10 years old, 20, can put you in the right bracket very, very accurately, actually. Now, the way we wanted to use this is to put it in public places, in service centers, in malls, and places that are crowded, to protect the elderly. So these are the segments that are in most danger, right? So if an elderly person walks into a mall or into a service center, you can actually approach him and give him a concierge service. If he's there to buy certain items, you can provide that for him. Please, sir, stay safe, stay in your car, we'll get you whatever you need, or even help him do that service. So this way, you're using this AI algorithm to keep these people safer, let's say. That's one way that we were approaching it. So I believe it's not a matter of if these algorithms are wrong or right. So in this context, if it misclassifies somebody's age, it's fine. Right? It's not such a critical system. And now for the medical domain, we can trust actually in the medical professionals that are using these algorithms. So they're not given total control over people's lives. We have experts with many years of experience actually keeping very close eye on these technologies. So yeah, I mean, that's my perspective on that.
Thank you, Dr. Abdurrahman. I think, as you've said, we have to approach this or these, let's say, concerns as a committee or a joint effort. It's not like somebody, one person's decision to deploy such technologies, etc. Because it goes through lots of levels, and it depends on how critical the system is. With that, I'd like to also ask another question to our audience today. Overall, do you think that COVID-19 will have a positive impact on our future? Have we learned something from them? Is it overall positive on our society? Yes, no, or you have mixed views in that regard? Until you answer this last question, I'd like also to ask the panel today one last question in a short sentence. Is moving to digital or emerging technologies, or let's put it, is digital transformation a necessity or luxury? I'll start with Brigadier Khalid.
Probably, as I mentioned earlier, that there's huge opportunities for our people to live in the current era, where with a lot of people, they are stuck and living in their houses and their rooms, and they're away from their families. So we have to work very hardly to provide those kind of necessary life or tools to them. As you're aware that the infrastructure is very important, the bandwidth, increasing the social activities, which is online services. Even we have to concentrate on gaming. Currently, our children are stuck 24/7 just playing those games online. So we have to be very careful about it, because a lot of crimes have been touching those kids. And so I encourage all the families to keep an eye on their children, see what they are playing with. Also, we need to provide, as a government, all kind of tools and service to our employees to work from distance. So we provide all kind of technologies, application that is running 24/7 to them, and also controlling and protecting those data. And I wish that one day that everybody gonna remove their mask, you can see their faces, because currently when you, guys, if you're walking in all the shopping malls, you don't find faces, you find masks, and you don't know who are the people in front of you. So pray to Allah that this disease will demolish completely from our world, and to return back to our life, to adventure, to be closely with our family and our kids, and or with our friends.
Thank you very much, Brigadier Khalid. With that note, I would like to give special thanks to all participants in this panel discussion for sharing their insights tonight, and all the audience for attending the event today as well. Until we meet again in future events, stay safe. دمتم في حفظ الله ورعايته والسلام عليكم ورحمة الله.